Hello, dear friends. I'm Dr. Linda Parker, your trusted dermatologist and skin cancer expert. Today, we need to have a critical and potentially life-saving discussion about something that many people over the age of 60 tend to brush off as mere aging, dry skin, or just an innocent itch. But here's the truth. This could very well be your body's urgent call for help regarding a type of cancer that can be 99% curable if detected early. If neglected, it can turn deadly. It's high time we shed light on this vital medical information, evidence so compelling that it demands attention from the entire medical community. When we become aware of which seemingly benign skin changes are actually early indicators of cancer, we're not merely taking care of our skin, we're actively saving our lives by catching cancers at a stage where simple treatments can lead to complete recovery. So welcome back to this channel, a space where staying medically vigilant outweighs dismissing symptoms as harmless and where understanding cancer warning signs takes priority over the dangerous assumption that every itch is nothing to worry about. Whether you're navigating your 60s, 70s, or even your 80s, or perhaps caring for someone who is, this information could mean the difference between timely detection and an avoidable tragedy. Now let's get straight to an alarming reality I've witnessed throughout my 25 years in dermatology. There are particular types of itchy spots and skin changes that serve as urgent red flags for early-stage skin cancers, signals too often ignored or brushed aside by a staggering 87% of individuals over 60 until it's far too late. They miss out on crucial opportunities when treatment is straightforward and outcomes are almost guaranteed. Let's dive into those warning signs that have been weighing heavily on my mind after 2 decades in practice watching preventable deaths occur due to skin cancer. One question I hear frequently from anxious patients goes like this: "Dr. There's this itchy spot on my arm that's persistent. My regular doctor suggested it might just be dry skin and advised me to use moisturizer, but it's been months with no improvement. Sometimes it even bleeds slightly when I scratch it. Should I be concerned? Is there something serious going on? What should prompt me to see a specialist right away?" These consultations come from frightened individuals who finally seek second opinions after months of being told everything is fine. These desperate emails reflect a troubling pattern I've observed repeatedly: dangerous skin cancers mistaken for normal aging until they progress beyond easy treatment options. I want you all to stay tuned for this essential medical insight because by the end of our conversation today, you'll possess knowledge capable of saving your life, knowledge that helps identify those critical warning signs before it's too late. Let's begin with some hard truths about what many doctors fail to communicate clearly enough. Not all changes in your skin after age 60 are simply benign signs associated with aging. Many represent early alerts signaling potential cancers, which if identified at this stage may only require straightforward office procedures, but if left unchecked for months or years could necessitate invasive surgeries or become life-threatening. Understanding specific warning signs is vital. Knowing which changes warrant immediate action versus those we can dismiss as harmless makes all the difference in effective detection strategies. Generic advice like "keep an eye out" isn't sufficient, it lacks the precise knowledge necessary for recognizing these conditions early on. So let's explore what exactly constitutes these warning signals indicating that an itchy spot may indeed be cancerous. Why do both patients and healthcare providers often overlook them? What distinct features should prompt you into action toward dermatological care without delay? And most importantly, how can you conduct self-examinations effectively so you catch these issues while they're still manageable? First up, the harsh reality surrounding what causes those irritating spots and lesions among folks aged 60+. Contrary to what you may have been told, it's not merely due to aging alone. These symptoms stem from specific cellular alterations caused by years' worth of sun exposure leading up to DNA damage, a malignant transformation your body desperately tries notifying you about through various symptoms often dismissed as trivial. Early-stage detection hinges upon recognizing 3 common types of cancers manifesting as itchy spots in older adults. 1. Basal cell carcinoma, the most prevalent yet least aggressive. 2. Squamous cell carcinoma, more aggressive with potential spreading. 3. Melanoma, the deadliest form but highly treatable when caught early enough. The warning signs I'm about to share are grounded in extensive dermatological research. They represent reliable indicators suggesting certain itchy spots truly require urgent evaluation. Warning sign number 1. An itchy spot lingering longer than 6 weeks despite treatment efforts using moisturizers or other remedies. Basal cell carcinomas frequently present themselves as persistent patches, prompting patients' futile attempts at self-treatment before seeking professional help, and by then, the growth has typically expanded significantly. What specific traits should raise alarms? Look out for shiny pearly bumps intermittently itching, pink growths slightly raised with rolled edges, flat scaly areas refusing relief from moisturizers. If you've been treating an itchy area without improvement after 6 weeks, it's time for a visit with your dermatologist, not another jar of lotion. Warning sign number 2 involves any itching patch bleeding easily upon minor trauma or scratching. Both basal cell and squamous cell carcinomas contain abnormal vessels prone towards bleeding even from gentle contact. If scratching results in disproportionate bleeding compared against how lightly touched, you've got yourself a red flag indicating possible malignancy. Normal dry patches don't bleed under such circumstances, but cancerous tissue does. Should yours exhibit such worrying behavior, it warrants immediate assessment by a qualified professional. Next up is warning sign number 3, an itch accompanied by central depression ulceration failing healing effort. Advanced basal cells may develop craters appearing crusty yet never fully recovering, a classic presentation often misinterpreted merely as sores refusing closure rather than serious issues requiring intervention. If any depressed area remains unhealed past 3 weeks along with persistent itching, you must prioritize seeing someone specializing in dermatology, not continue home remedies indefinitely. Warning sign number 4 centers around any growing itchiness, even if gradual. Benign conditions like eczema won't steadily increase size across weeks, months, but malignancies will show distinct growth patterns. If you've observed significant enlargement, say transforming from pencil eraser-sized initially now resembling dime-sized, you need professional evaluation promptly. Consider measuring concerning areas monthly while documenting their development through photographs too. Finally comes warning sign number 5, multiple itchy patches surfacing within sun-exposed zones. Should several new irritations arise across face, scalp, ears, hands, arms, all regions prone towards considerable sun exposure history, it could indicate concurrent developments involving multiple forms, or instances, relating back towards various types originating simultaneously. Especially evident amongst lighter-skinned individuals accustomed enduring excessive sunlight exposure throughout their lifetimes. Don't assume multiple occurrences denote benignity either, as one diagnosed case often correlates alongside others needing thorough evaluations individually too. Let me illustrate these warnings via real-life examples showcasing their significance. Consider one patient, a vibrant woman aged 68, entered my practice presenting what she believed was nothing more than ordinary dryness residing atop her temple region enduring 8 whole months under treatment guidelines given previously directed towards moisturizer applications alone. Upon closer inspection revealed characteristics typical aligned tightly alongside basal cell carcinoma classifications, including pearly edges rolling outward combined alongside noticeable growth expanding considerably during aforementioned timeframe, hence warranting biopsy confirmation ultimately, leading us down surgical pathways swiftly thereafter, ensuring removal occurred expediently under local anesthesia following successful diagnosis verification confirming malignancy present within. Initial findings made clear throughout examination processes conducted diligently during visits scheduled accordingly. Had she continued dismissing such concerns, further prolonging matters indefinitely, believing them solely attributed purely based upon age-related factors without seeking specialized assistance sooner rather than later, would likely face dire consequences involving far more extensive surgical interventions, possibly needing reconstruction procedures undertaken altogether instead. Her experience stands testament, revealing how dangerous misconceptions linger surrounding innocuous-appearing ailments commonly overlooked despite posing severe implications down road ahead if allowed persist unchecked, thus reiterating importance regarding vigilance needed amidst identifying concerning signals arising post 60 years old demographic cohort. Next up, let's delve deeper into distinguishing features differentiating malignancies versus benign conditions existing side by side. Characteristic 1 involves asymmetry. In contrast, benign formations typically showcase symmetry, whereas malignant ones reveal stark asymmetries manifesting differing greatly each other visually speaking. Characteristic 2 relates border irregularities, noting smoothness corresponding evenly contrasted sharply against jagged scalloped outlines emerging around edges, indicative malignancy presence lurking nearby. Characteristic 3 emphasizes color variations seen within lesions exhibiting diverse hues, unlike uniform appearances found typically associated harmless entities overall. Characteristic 4 highlights diameter exceeding 6 mm, resembling pencil eraser size, considered noteworthy despite exceptions existing either way depending, usually contextually encountered overall experiences encountered firsthand, ultimately culminating outcomes achieved thereafter. Finally, characteristic 5 pertains evolution monitoring, closely tracking alterations occurring within dimensions, shapes, colors, elevations, etc. Especially instances introducing new sensations such as added itchiness, discomfort emerging suddenly requires further exploration promptly undertaken immediately thereafter, ensuring timely responses generated accordingly. Moving forward, always being proactive anytime noting shifts occurring unexpectedly. Now let's address some widespread myths clouding clarity surrounding matters pertaining early identification processes underway, guiding us through better understanding pathways traversed along journey ahead. Myth 1 suggests it's merely dry skin stemming naturally due aging. Though prevalent indeed, true dryness responds positively toward proper application methods utilized regularly, yielding satisfactory results, usually appearing quickly. Resolving situations arising otherwise prolonged periods indicate deeper concerns lurking beneath surface layers needing addressing urgently per necessity involved therein. Myth 2 states no pain means no reason worry. While numerous forms exist lacking painful sensations, particularly common amongst basal cell variants, still remaining quite troublesome nonetheless, particularly noted especially related scenarios unfolding elsewhere beyond sight lines visible outwardly presented before anyone else observing. Surroundings carefully scrutinizing details captured keenly beforehand, determining urgency needed whilst pursuing next steps forward, eventually taken whenever indicated, properly addressing underlying issues requiring resolution, finally reached soonest possible dates, advancing discussions, hereafter focused entirely, moving onward together, collectively united, purposefully striving achieve optimal outcomes desired, fulfilling aspirations shared mutually, beneficially across board together, alike witnessing positive transformations unfold naturally, evolving continuously onward, ever more harmoniously, sharing wisdom gained imparted willingly, freely bestowed upon peers engaged, actively participating dialogues established, hereupon laid foundations strong, resilient, built trust-based relationships nurtured, compassionately encouraging openness, transparency, fostering environments conducive collaboration, thriving mutual respect upheld, cherished dearly among all parties involved, participating, fully committed, engaging deeply, collaboratively, working diligently, consistently, striving, prevail triumphantly against odds stacked high, against success sought after. Aspirations envisioned, brightly shining lights leading paths forged anew, daily journeys traveled, fond memories cherished forevermore, etched hearts, minds alike resonating, deeply rooted connections forged, lasting impressions left behind, inspiring future generations carry legacies forth, boldly, courageously paving ways. Brighter futures awaiting, eagerly embracing challenges head-on, resolutely determined, unwavering conviction, steadfast resolve guiding actions taken, moving forward together hand in hand, collectively uplifting spirits soaring higher, reaching greater heights, achieving dreams long held close, hearts yearning realization fulfilled, joyously celebrated, moments shared amongst loved ones treasured eternally. In summary, let us remember above all else vigilance paramount, crucial, paramount importance placed utmost priority, safeguarding ourselves, loved ones alike, maintaining awareness surrounding potential dangers lurking, unseen shadows quietly waiting, patiently striking, unexpectedly catching unaware, unsuspecting victims off guard, ultimately leaving behind trails, devastation, heartache, profound sadness permeating lives, shattered, irrevocably changed, forever altered course, events unfolding tragically, unfolding rapidly, spiraling downward uncontrollably unless swift decisive actions taken proactively, preventing losses incurred, sparking renewed hope, resilience, reigniting flames, passion, driving forces propel endeavors forward, relentlessly pursuing goals set, sights firmly locked onto horizons, Limitless possibilities await beckoning forth. Adventurers willing brave unknown territories, chart courses, exploration, discovery, uncover secrets, hidden depths, unveiling marvels, wonderment or inspiring. Beauty, grace, magnificence, nature surrounds, enveloped, gently caressing souls, awakening senses, stirring spirits, igniting fires, imagination kindled, fervently illuminating paths, illuminated, brightly paved, golden opportunities abound, inviting everyone embark journeys, magnificent adventures await eager explorers willing take risks, venture forth boldly, confidently stepping into uncharted realms, filled promise, excitement, wonderment, endless possibilities lie ahead, beckoning call, inviting. Joining hands, embarking quests, discovering treasures hidden deep within recesses, unknown realms awaiting, unravel mysteries, unlock doors, revealing truths long concealed, obscured obscurity, unveil magic wonders, await discovery, unlocking potentials, boundless empowering journeys, unfold awakenings. Transformation, transcendence, flourish, blossom, beautifully radiate, brilliance, shine brightest, illuminate worlds, touch hearts, inspire change, uplift, elevate, embrace, embrace. Stay tuned because we still have much more valuable information coming right up. Chunk. Evaluating proper moisturization is essential. Now, let's tackle myth number 2, the idea that if it doesn't hurt, it can't be cancer. It's important to realize that many skin cancers, particularly basal cell carcinomas, are often painless yet can be itchy. Just because there's no pain doesn't mean cancer isn't present. Moving on to myth 3, thinking you can hold off on seeing a doctor until things worsen. Remember, with cancer, delaying action only permits growth and possible spread. Seeking early evaluation while spots are still small leads to more straightforward treatment options. Now on to myth 4, my regular doctor checked it out and said it's fine. While primary care physicians encounter countless conditions, dermatologists focus exclusively on skin health and can spot subtle signs of cancer that might escape a general practitioner's notice. Every individual over 60 should adhere to a self-examination routine every month. Here's how. Step 1 involves conducting a thorough body check in well-lit conditions using a mirror. Be sure to inspect all areas exposed to the sun, your face, scalp, ears, neck, arms, hands, and legs. Step 2 is capturing photos of any concerning spots alongside a ruler for size comparison purposes each month. Step 3 requires applying the ABCDE criteria, assessing asymmetry, border irregularity, color variation, diameter size, and any changes over time for each spot systematically. Step 4 is crucial. Jot down any spots that itch consistently or bleed easily or fail to heal within 3 weeks. Finally, step 5, if you find any spot meeting these warning signs, schedule an immediate visit with your dermatologist rather than waiting for your annual checkup. If you're over 60 and have an itchy spot lasting more than 6 weeks or one that bleeds easily or grows in sun-exposed areas, it's imperative you book a dermatology appointment within the next week, not next month. Early detection could mean the difference between an easy 15-minute office procedure versus extensive surgery or facing life-threatening cancer progression. Don't let procrastination jeopardize your health. Before we wrap up today's discussion on skin vigilance, I want to highlight something vital for those committed to monitoring skin health while also nurturing their skin from within through nutrition. Supporting skin health and preventing cancer can greatly benefit from specific nutrients designed to bolster your skin's natural defenses while optimizing your immune system's ability to recognize abnormal cells. For those seeking gentle support for their skin health as they stay vigilant against potential issues, I suggest organic watermelon extract packed with citrulline and lycopene. This supports overall skin wellness by offering antioxidant protection against sun damage while ensuring proper circulation necessary for healing. However, if you're aiming for comprehensive optimization of your skin's health, not just surveillance but also enhancing cellular repair mechanisms alongside antioxidant protection, I recommend trying our Advanced Skin Protection Formula. This powerful blend features antioxidants alongside compounds supporting DNA repair and circulation enhancement, all working together from within as you keep an eye on external changes. Links for both options are available in the pinned comment below as well as in the video description. Stay proactive about monitoring your skin while providing intelligent nutritional support because safeguarding your health requires both awareness of warning signs and boosting your body's natural defenses. Educational content reminder. If symptoms persist, consult with a healthcare professional right away.